going through medical training and still having, so many hurdles and obstacles to ultimately beat his illness. It's truly inspirational. But I think it also kind of tells us a story about our healthcare system, right? Like, let us imagine if Dr. Dotson wouldn't have had the connections, the network, the expertise to be able to navigate his illness, to be able to reach out to these, world-class institutions, right? Like, how would that have ultimately changed his trajectory? And, kind of as he pointed out, all glory to the Most High. I myself am a Christian as well, and we oftentimes kind of put our dire situations in the hands of humans when at the end of the day, everything is in the hands of God. So thank you so much for that, Dr. Dotson. Genuinely inspirational.
And let me give him a proper introduction here. Yeah, Barbara, let's give Dr. Wiltz a proper introduction here. Dr.
Okay, because Dr. Jagdeo should be joining us also right now. Let's do both together then.
Okay. Dr. Wiltz is a Transformative Justice Coalition certified voting rights advocate and alumni. He participated in the September 2024 class. He earned his Doctor of Medicine and his Master of Business Administration from Howard University. He also holds a Master of Public Administration and Public Policy from Eastern Illinois University. He's a first-generation physician, and one of his greatest motivations is tackling, dissecting, and solving various facets of healthcare disparities domestically and globally. So, Dr. Wiltz, certainly want to welcome you to Igniting Change. And Barbara, you want to bring up Dr. Jagdeo?
Yes, Dr. Carol Jagdeo is amazing. This is her second time joining us on a show where we're trying to save lives by making sure that people have the medical and preventive care that they need. Dr. Carol Jagdeo is an internist treating patients in the Washington, D.C. region. She earned her bachelor's degree from Cornell University. She earned her medical degree from Perelman School of Medicine at the University of Pennsylvania. Dr. Jagdeo's residency was completed in internal medicine at Georgetown University. She has been a practicing physician for more than 20 years. Okay, so she's not on yet. Stanley, as soon as she joins, please let us know. We know she's treating patients today, so we expect her to join momentarily. So let's continue. Kyron, you're a young man, and a lot of people think that their youth, the fact that they can, do, certain things means that they don't have to worry about their health. But is that true, sir? Isn't it true that we always have to worry about our health and not think that certain diseases are just, quote, old people diseases?
Yeah, no, absolutely. I think that narrative is false. A lot of my colleagues, a lot of my mentors, a lot of publications now are even pointing out to people getting cancer a whole lot younger, more specifically types of colon cancer. So it's imperative that we kind of use all of the tools at our disposal, more specifically social media. Like there's a guy, Dr. Joel. He's known as the medical mythbuster, and we graduated medical school at the same time, if I'm not mistaken. But, he kickstarted his social media presence, really kind of looking at the disparities in healthcare. And it kind of became like a movement within itself because young people, it's kind of our time to kind of start pushing certain things forward. And, with D'Angelo passing recently, right, from pancreatic cancer, I think it's opened a lot of people's eyes. Because I think D'Angelo was 52, 54, like somewhere in that area. My mom isn't even 50 yet. I'm about to become 30. So it's, we are seeing people that, for all intents and purposes, we've grown up with. They've become a part of our lives. The Saturday morning, cleaning up, the D'Angelo music, the Angie Stone playing in the background. And it's like we look at these things and these people are no longer with us. And similar to how people such as Magic Johnson and Rod Hudson were for HIV, my generation have had similar people from pancreatic cancer. I remember when Steve Jobs was first diagnosed. So when we kind of start beginning to look at those situations,
John Lewis is another.
Yeah. Yes, and my apologies for forgetting John Lewis. But it's again, these are people that even from afar we build bonds with, and as young people, right? The iPhone is literally closer to us than our hearts. Or so Steve Jobs, all of these people that we are seeing, and then even in Dr. Dotson's case, people that we actually can touch are being impacted. So I think it's a false notion for young people to believe that, I'm too young to have to worry about eating right, to worry about, going to therapy for my mental health, or exercising, or going to my wellness visits. So we always have to be on top of these things.
So well stated.
Dr. Wiltz, one of the things that I find really interesting is that, Dr. Dotson, as you've indicated, had access to many professionals and a lot of care and a lot of insurance. There are a lot of Americans that do not have that type of access. They're not going to have access to be able to pick up and call a friend who's a physician, or they may not have the medical insurance, and their medical insurance may put them through all kinds of rigmarole in order to try to find coverage in places that they can go to be treated. Is this indicative of a problem that exists with American healthcare policy?
Absolutely. I think anyone would be hard pressed to try to argue otherwise, right? So let's say pancreatic cancer, for example. Not only is it one of the hardest to detect, but because it's so hard to detect and it's already kind of aggressive, that by the time you did the actual diagnosis, right, it's already stage 2, stage 3, and in many cases stage 4. So then it becomes a race against time. My time becomes a little bit more restrictive if, again, I can't get care, if I can't get approved for MRIs or CT scans. Dr. Dotson pointed out, he was able to reach out to a friend, hey, I need this, get the prescription for the MRI. But the majority of Americans don't have that access. And I genuinely think that, it's just simply unfair. Like, no one wakes up one morning and says, like, maybe I want pancreatic cancer, or maybe I want a brain aneurysm, or even something less, like that I have a cold. Can you say it again?
Wonderful. And I believe I heard that Dr. Jagdeo just joined us. Is that correct, Dr. Jagdeo? Are you there?
Am. Sorry, I'm a little bit...
Thank you so much for taking a moment out of your very, very busy practice to join us. We are so grateful for you to be here today. Can you help us to understand why preventative care is so critical, and why, when we're talking about cancer, early intervention is absolutely imperative?
That's correct. First of all, I'm an internist in Washington, D.C., and I've taken care of a whole spectrum of patients with different types of cancers. But early prevention, early detection, and early intervention is the key to good cancer care. Now, for a lot of our patients, especially patients of color, all ethnic groups, there are some predispositions to say for developing breast cancer or prostate cancer or colon cancer, thyroid cancer. These are all cancers that tend to be somewhat more prevalent in patients of color. So aligning yourself with a knowledgeable clinician who cares for patients and who are determined to do as much as they can for educating the patient is important. And this of course, takes time. And time is the thing that we don't always have a lot of in a private practice, in a practice. So taking time to educate the patient and get the patient in, line them up with the right resources, and also make sure that they have the basics, because this is what prevention is. Prevention is looking for a disease entity before it becomes a problem. And, prevention for a lot of patients, unfortunately, our healthcare system is geared to not prevention, but treatment after the occurrence of the process has occurred. So prevention is really the key to identifying early disease and then aligning the patients with the right resources so that the condition could be addressed using all the national guidelines that we practice medicine by.
And Dr. Jagdeo, I want you to know that Dr. Richard Dotson, who has written this amazing book that we are talking about today, Unbroken, A Survivor's Guide to Cancer, is on the show. And he's talked about how he had to repeatedly seek the right diagnosis, how he went months, going to doctors trying to get the right diagnosis and being told it was one thing or the other, and still being in pain, having severe discomfort. So he eventually got the right diagnosis. When you talk to our national audience, we're in 45 cities, we're international, 13 nations. What do you want people right now to understand about what they must do for preventative care?
Right. So preventative care, because I am an internist, I deal with lots of different disease entities, not just cancer. But preventative care is mandatory for laying a good foundation for the delivery of good health care to our patients. And we're talking about entities like heart disease and diabetes and dementia and things like that. So cancer we focus a lot on, and I understand the show today is on pancreatic cancer.
Yes.
Dr. Dotson, can he hear this conversation?
Yes, I'm listening to you. It's very nice to meet you. We have many patients in common over the years. And,
that's what I thought. As I saw the name, I said, Dr. Dotson, I believe you're an ophthalmologist, aren't you not?
Exactly. 40-plus years in D.C. on Benning Road, Northeast Washington, D.C. Absolutely.
Yes.
I am Dr. Dotson.
Yes. Well, thank you very much. I'm honored to be in the same room with you because I've heard so much about the quality of care that you've given your patients. So I do look forward to meeting you one day. But, Dr. Dotson, I think the point that is being made should be well taken, and it's not just a problem. It's not just a problem that's unique to the American system. It's really a worldwide problem where patients are not given good basic medical care, and they are not aligned with the right resources early on. So what happens is that there's a failure to diagnose, and there's a delay in diagnosis, and then there's a delay in treatment. And that could be a multifactorial reasons. Lack of medication, lack of knowledgeable patients, patient not they don't know what to ask for, and they're depending on professional people like us who then fail them because we don't give them what they need and what they deserve to get very early on. So we end up losing patients when we should be preserving life. And for me, that's very important because I'm an internist, and I've been an internist for a number of years. But I care about my patients, and if I cannot help you, I will find someone who can help you.
Mm.
And that's very important for us.
There's one other component about